my name's Jenny, and Kylie and I both own Thrive Therapy, which is a mobile outpatient therapy provider. And we focus more on the South Denver metro area, but we're kind of all around throughout the Denver area. So today I'm going to share my screen here. We've made a little PowerPoint about doing some exercises and staying fit and strong while you're kind of stuck a little bit at home. So let me get my screen shared here. That's not what I want. Hang on.
But it's good.
Okay.
I got them in love with their baby.
Yeah.
Okay, can you see that? It says fit and strong at home.
Yes.
Okay, great. So like I said, my name's Jenny and I'm an occupational therapist and I've been in OT for, like around 7 years. And I'm gonna let Kylie introduce herself and then we'll get going.
And I'm Kylie, and I'm an occupational therapist as well, and I've been in OT for 6 years, and we are excited to share some information with you guys today. So we are going to talk about being fit and strong, why we stay at home, and especially during this time of COVID and why it's so important. So just a few facts. Muscle strength is directly related to falls. So we want to stay strong to help prevent falls. And falls are the #1 cause of injury and accidental death in adults over the age of 65. So falls are the #1 cause. So we'll teach you some ways to help prevent falls.
And one other little fun fact is that lower extremity strength, so keeping your legs strong, is really a big indicator kind of relating to falls. So if you have strong legs, your fall risk goes down. So we're going to focus on strengthening everything, our arms, our legs, our core, but just know that it's important to keep your legs strong especially. And you can do that in multiple ways, which we'll talk about here. So just first, how much activity do you really need? So this is according to the CDC. They recommend about 150 minutes a week of moderate intensity aerobic exercise. So anything that really gets your heart rate up a little bit, keeps you moving. So walking, swimming, they have little pictures here, someone golfing, raking, doing yard work, things like that.
Should be here after 1 o'clock.
So just making sure that you're moving your body really, but getting your heart rate up while doing that. Even cleaning, whatever it might be. And then muscle strengthening, they really recommend you do something 2 days a week. So that would be lifting weights, stretching. We'll give you some great ideas of things you can do, but I think a lot of people tend to leave out the strengthening piece and kind of focus more on the aerobic activity. It's really important that you do it.
Did someone have a question? No. Okay, so the benefits of strength training. It is important to try to do it 2 to 3 times a week to help build and maintain that muscle mass. Again, 2 to 3 times a week might not be realistic, but that's a goal to shoot for. And exercising 2 to 3 times a week can help preserve our bone density, help increase our overall independence with all of our self-care tasks, and help vitality with age. Just help us age and help us feel good. Also, the benefits of strength training helps reduce the risk of osteoporosis and the signs and symptoms of numerous chronic diseases. So we all know this. Exercise helps prevent heart disease, arthritis, type 2 diabetes. It helps improve our sleep, helps improve our overall mood. So there's many benefits of strength training, not just to help our body, but to help us feel good overall.
Yes, so we kind of already mentioned this, but one of the ways that it helps prevent osteoporosis is it increases your muscle mass. So they say that by the age of 70, you lose 25% of your muscle mass. So it's really important that you're doing exercises to kind of maintain that and even improve. It also helps improve functional movement, which means basically the movement that we have to do throughout the day to do our daily tasks. So it helps you to be more mobile. Hopefully it will make you be able to walk around and get around without using an assistive device such as a cane or a walker, and also improve your mobility as well. So we're going to talk about some stretches, and I think stretching is really important before and after you do strength training, just to keep your muscles lengthened and make sure that you're not going to have any injuries and things like that. It also helps better your body composition, and kind of like Kylie mentioned, helps with your mental health as well. So not just physically, but also helps you feel better, improve your mood, improve your quality of life. A lot of people hear the word endorphins, you know, those chemicals in our brain, those happy feelings that we do with exercise. So not just aerobic exercise, also strength training.
So why it's important to strength train safely? There's a few reasons. So education first and foremost, we want to make sure that you are safe and that you have the correct form, the correct body mechanics when you're completing these movements, so that you can continue to do it from time to time and not feel like you get hurt. Strength training should feel good. It shouldn't hurt you. We want to train, don't strain. So again, Jenny talked about how our lower body, it's important to keep those muscles strong, but it's also important to hit all the muscle groups in our body. We use our arms to get up and down. We use our arms to reach for things, to pull up on things. So it's important to hit all muscle groups in your body. Approximately 1 to 2 sets would be good, in 8 to 15 reps. So I think sometimes we get stuck on doing things at the maximum amount. And if you're not feeling good that day, or you're not having a great day, maybe you do 1 set and you do 8 reps of each. And then we want to focus on breathing first and foremost. We want to make sure we're breathing through each movement and not holding our breath. And then it's really important to listen to our bodies. If something doesn't feel right, don't do it. If it's too heavy, don't lift it. And if you're just not feeling like it that day, then maybe you don't do it at all. And then the progression of exercise, it's really important to speak with your doctor or a physical therapist on how you're going to do your exercises, and to help them walk you through a home exercise program or an exercise program in general, so that they can provide modifications for you. They can help with your technique. They can let you know if you should increase your weight or decrease your weight. So speaking with a professional is very important.
Okay, I hear, can you guys hear me okay? I know.
Now I can.
Now it's better, but sometimes it's really broken up.
Okay. Let me know if it stays that way, and I'll just make Kylie talk. No, just me. Okay, sorry. Go ahead. You message.
Okay, it's doing it again. Jenny, it's doing it again.
Okay.
Okay, mute yourself. I'll start talking for a little bit and we'll have her move around. Okay, so benefits of aerobic exercise. We talk a lot about strength training, but it's also important to do aerobic exercise as well. So according to the Mayo Clinic, aerobic exercise also keeps your muscles strong, helps maintain your mobility to move around, and again, helps lower the risk of falling and the injuries that we get from falling, and it helps improve your quality of life. It also helps keep your mind sharp, helps your memory, it helps your reasoning, your recall, your problem solving, all of those things that we want to keep going as we age. Aerobic exercise helps prevent the onset of dementia and can improve the cognition in someone that already has dementia symptoms. So doing aerobic exercise and strength training on a normal basis is a good thing.
Okay. I'm gonna try and see. Okay. Is this better, Erin?
For now.
Okay. Okay. So the U.S. Department of Health and Human Services recommends that all adults, so not just older adults, but all adults, do strength training at every muscle group at least 2 times a week.
Okay, we can't hear you now.
Okay, I'll jump back in here. So she already talked a little bit about this, but it's important that you hit all muscle groups at least 2 times a week. So maybe you look at your calendar and you determine 2 days that work for you to strength train. And I recommend them being days that are not back to back so that you give yourself a chance to rest and your muscles to have a day of relaxation. And if health or ability prevents 2 full sessions, then just do what you can. So maybe you start off with a goal of just doing this once a week. That's better than not strength at all. Okay. And again, exercising regularly can help keep your mind and body healthy. We already know that. And so we're going to go through a few simple exercises that you can do at home. Again, I will provide some demonstration that I can, and then know that any of these exercises can be completed seated or laying down in bed.
I could do the demo. You talk.
Okay, so I'll talk and Jenny can do a demonstration. I don't know if that's going to be clear on your screen, but we'll give that a try. So the side stretch, and if you are able to, you can go through these with us. So just sitting up at the edge of your chair, both feet are flat on your floor, and you want to check in with your posture for all of these. Shoulders are down and back, your core muscles are pulled in tight, and take a deep breath. And then you just want to take your arm up and reach over in the shape of a C. So Jenny's going to demonstrate that. And lean to the side. Again, do what feels comfortable. Hold for about 10 seconds as you're breathing, and then come back to the center and try the other side.
You want to do it just in case?
Oh yeah, I can do it with you. But it should feel good. You should feel a nice stretch through your shoulder, through your core, even down into your hips. And you could go back and forth if it feels really good. Okay, we'll keep moving. So the hip stretch, this is one of my favorites. This is gonna be harder for you to see from me doing, but I can try. So you just wanna cross that leg. And again, this might be a hard position for you to get into. Oh yeah, Jenny's doing it good. So if that's too hard, it's okay if your leg is bent up. You'll see Jenny, she'll kind of bend her leg up, or you can even slide it down. So whatever you need to do to just feel a stretch in your hip, in your glutes, and if it's easy for you, you could even add a little lean forward.
You should feel this in your outer hip.
Yeah, and your outer hip back into your glutes. And again, if it's uncomfortable, then don't do this stretch, but it should feel good. And it's so important to keep our hips loose and open. So again, hold for about 10 seconds and then switch legs. Okay, a back bend. So again, you're sitting upright at the edge of your chair, feet are flat on the floor, so you're back in that neutral position again. And then you just want to look up towards the ceiling, so you're getting a nice stretch in your neck. You can just stay right there. If you want a little bit more of a stretch, bend back just a little bit so you can feel a stretch in your lower back, opening up through your chest. And make sure you're breathing. And again, hold for about 10 seconds before you head back to your neutral position in the center. Yeah, I think it's good you're demonstrating. I like the side angle. I don't know if you guys do. Okay, shoulder press. So all the exercises today we're demonstrating without weight, but you could have a couple pounds in your hand. You could grab 2 soup cans, a couple water bottles, but sitting up nice and tall. Arms are out to the side. Hands are at shoulder height, and you want to press it up with your palms facing forward and then back down. Nice and slow, get a good range of motion. And again, this should feel good. And the goal is to try to get those arms up nice and straight and bringing them back down. 10 reps is the goal. Okay, shoulder raises. So now we're going to start with our arms straight out in front. Palms are face down on your knees. And then you want to bring your arms up so they're even with your shoulders, and then back down. So arms stay straight, bring them up to your shoulders. If you have weight and it's too hard, you can always alternate one arm at a time. Again, moving nice and slow, and about 10 reps each arm. Okay, a chest press or a wall push-up. So if you're just seated in your chair, arms start up right in front of your chest, palms are facing down, and you'll press out to the screen in front of you and back to your chest. Again, if this is too hard, you could alternate arms. And if you really wanted to try a wall push-up, you could go to a wall, standing straight up. Yeah, Jenny can try to demonstrate. And get nice and close to the wall. Start with your arms straight out, and then you'll bend your elbows and you will lean. Yeah, I think we'll be able to see you.
Can you see me?
Yeah. Go that way more, go into the white. Yeah, right there. So watch Jenny as she just bends and she leans into the wall and then she pushes back. To make it a little bit easier, she would walk her feet closer to the wall and just do a little push. And to make it a little harder, she would step back. So we can still do push-ups at any age. Oh, you're fine. Okay, a core twist, a tummy twist. So again, you can have your weight in your hand, you could have a ball, you could have that soup can in your hand, sitting up nice and straight, elbows are bent at your side, and you just want to do a twist, and your core is pulled in. So think about bringing your belly button into your spine and then back to the center, and then twist to the other side. If this causes any aches or pains in your back, then maybe this isn't quite the exercise for you, but what you're focusing on is your core muscles twisting you side to side. Okay, calf raises, feet are flat on the floor, sitting up nice and tall. You want to lift those heels up nice and high and then lower back down. And you can kind of squeeze your calves as you lift to really focus on that. If you are good and you're moving around, you could stand at the back of a chair and just lift up your heels and back down.
Can you see that?
Yeah, I can. That's good. I think it's good you're demonstrating. Okay, knee extension. Again, sitting upright in that neutral position. Hands can be on a supported chair. They could be down by your side. You just want to extend one leg straight out in front, really focusing on squeezing the top of that leg and trying to get your knee nice and straight, and then lower back down, other side. So the main focus is getting that leg straight and really kind of squeezing that muscle at the top. Is it helping with Jenny's demonstrations? I hope. Okay, heel slide. So you're sitting, again, just at the edge of the chair, and you're gonna reach that foot straight out, tap it out in front, pointing those toes forward, and then pressing into the floor as you bring it back. So you can feel the back of your leg working on this one. So reach it out, and then as you press into the ground and you pull back, you'll feel your hamstrings working. And there Jenny is demonstrating it, alternating legs. Yeah, good.
I can show them.
Yeah, chair squats. So again, if you don't feel comfortable standing or you don't have a stable surface, I would just stay seated. But you want to have both hands supported on a surface. So Jenny is using a chair, you could use a counter, and then you just want to have your feet shoulder width apart, and you're just going to sit back like you're almost going to sit into a chair and then stand back up. Weight is centered through your feet. You want to keep your chest up and open and looking forward. You don't want to look down at the floor. And it's just a little squat, pushing through your thighs, pushing through the biggest muscle of our body. Tricep extension. So again, if you have your hands or your weight, you're going to bring your arms and your elbows up and back with your elbows close to your side. And then you're going to extend your elbows so your arms are straight, and then bend at your elbows again. So you're not moving your shoulder at all. If you look at Jenny's shoulder, it's staying in place. She's just moving at the elbow joint, and then she's squeezing the back of the arm as she extends. If this is uncomfortable for you to do bending forward, you could always put your arms on a chair. I don't know if I can demonstrate this one. Elbows are pointed back, and you can lift yourself up and lower, again, squeezing the back of our arms. It's important to keep our triceps strong because every time we get up and down from a chair, we use our tricep muscles. So we want to keep them strong. Oh yeah, you could do this one standing or sitting. So it might be more comfortable for someone to do it standing. Bicep curl. So again, start in a neutral position, seated or standing. Arms are straight down in front. So elbows are straight, palms are facing forward. And you're gonna bend at your elbow, bring your hands to your shoulders, and then slowly lower them back down. This is working the front part of your arms, so you want to be squeezing your biceps as you're lifting your arms up. If it's too much, you could always alternate one arm at a time. And our triceps and our biceps are a little bit of a smaller muscle group, so you might have to change your weight for that. You might have to have a little bit lighter weight, or you might be able to do heavier. Okay, rowing. So if we're seated, like Jenny is starting in this position, start with your arms down and next to your legs, shoulder width apart, and then bend forward at your hips. And you're gonna pull your elbows and your arms back, and you're gonna stay there, squeeze your shoulder blades and back down. So we're focusing on our upper back. You could think about having a pencil on your spine and you're just trying to squeeze it and hold it in and let it go. You could do this exercise seated or standing as well. You could always, yeah, and keep your elbows in close to your side. You don't want your elbows out. Yeah, dead bugs. Well, real quick, I'll explain this exercise and then we'll show a modification. So you could do this laying down in your bed. Or on the floor if you are still getting down to the floor level. But we're focusing on our core here. So everything is going to be pulled into the surface that you're laying on. And then opposite arm, opposite leg are going to reach in the different direction. I don't know if Jenny can demonstrate it at all. If you're laying down. So opposite arm, opposite leg. And you're working on your core, bringing your arm and leg together and then extending them back out so that they're straight. Or you could even work, yeah, we'll see what Jenny does. There we go, that's good. Yeah, that's perfect. So opposite arm, yep, and then extend it back out. You could also work on just bringing your knee to your chest and kind of pulling it in and then letting it out. There you go. And right now, Jenny's core is pulled into the ground, so she's focusing on her stomach muscles. If you didn't want to get into your bed, you could just sit in your chair and do marches, sitting up nice and tall, lifting up one leg at a time. Jenny will show this one, and doing like a little seated modified crunch. Yep, getting your knee up nice and high and crunching.
Yeah, you can do this.
Oh, yep, and she's adding a little twist. She's getting crazy on us, you guys. There we go. Elbow to knee, opposite side. We're getting there. We're almost through these. So hip bridges, again, laying in bed. These are even good exercises to do in the morning before you get up or before you go to bed. But again, laying flat on your back. Bring your feet up. So bend your knees, bring your heels close to your bottom. Knees are bent, feet are flat on the floor. And then pull your abs into the ground before you move and then lift those hips up. It might be easy, it might be hard. So just try to get off the ground a little bit, but you want to push through those feet and get your hips up as high as you can, and then you squeeze your glute muscles. Having your hands supported out to the side on the ground is going to help give you some stability. And then you can even hold it up at the top for 10, 20 seconds, squeezing your glutes. So it's really important, again, to keep our glutes strong, our hamstrings, our quads strong to help prevent falls. So I hope you have fun going through those exercises. So tips to prevent falls at home. Again, a lot of these things are just common items, common tips, but it's good to go through them and good just to remember them. So keep your floors free of clutter and electrical cords. Don't have things in common pathways. We do not want you to fall. Don't walk with socks on. Try to wear a rubber sole or a non-skid shoe, slipper, or sock that gives you that grippy surface with the ground so that you are not slipping and sliding. Have a nightlight on in your bathroom at night, or keep a lamp on that you could just turn on next to your bed. So we wake up at night, we have to go to the bathroom, but that's when a lot of falls happen. We're kind of confused or we're disoriented. So just keep a nightlight on. Ensure that make sure you have plenty of lighting throughout your house. So have lamps, have additional lighting throughout rooms so that you can really see where you're trying to go to help prevent falls. If you use a walker or a cane or any kind of assistive device, then use that. Keep it with you, keep it next to your bed, continue to use it to help prevent a fall. And then just remember the medications you're taking. The more medications you're on, the higher risk of falling, and just know the side effects of your medications. Do they cause dizziness, loss of balance? Talk to your doctor about it, go through it so you really understand what your medications, how they affect you. And then tips to prevent falls when you're out and about and going around in the community. Probably not as much these days as you do in the past, but we're gonna get back to it soon. So make sure you have supportive footwear on, a good pair of sneakers that are supportive, that have good soles on the bottom. Check your shoes, look at them. When was the last time you got shoes? Investing in a good pair of shoes can go a long way with your overall health. Have your eyesight and hearing checked every year. How many of you guys do that? It's really important to have your eyes checked and your hearing to make sure that if you do need something that you're getting that. Perform exercises and attend exercise class. Exactly what we've been talking about today. So all of these exercises we've provided for you today, you could try them twice a week. You can maybe sign up and go to an exercise class or do a Zoom class so that you're keeping your strength up. Keep a checklist of items that you need to take with you so that you're nice and prepared before you get out in the community. Like you have your mask, your walker, hand sanitizer, your cell phone, your to-do list, your purse. Make sure you have all those items with you and you're prepared before you even get out in the community. And then be sure to keep the walkway outside of your home, maybe going out into your driveway, going out into your garage, wherever that is, free of clutter, free of hazards, free of everything, so that you have a clear path to walk in and out when you're outside. And then travel in the community during daylight hours, if possible. Go out during the day, maybe go out with a friend, a family member, and make sure everything is well lit. So if you are returning home at a later time, that you have lights on, you left lights on in your house, you leave a front porch light on so that you can see where you're going. So the biggest thing, just set yourself up for success before you're going out in the community. Oh, okay, that was a lot. So do you guys have any questions? Violet's going to stay nice and quiet.
Well, I have a silly question.
That's fine.
I was considering investing in a stationary bike. Is that a good idea?
You know, I think that's a great idea. It stays placed in your home. Would it be more of a recumbent style where you're sitting down, or one you're sitting up?
Probably sitting up.
Okay. I think it's not a bad idea. You can get exercise in right at home. You're stationary, so you're less likely to have a fall. You could do it for
I
10
have
minutes.
2 black labs, so that's why I don't want to go out riding.
Yeah.
They would jump on me.
Well, and I think then if you have it in your home, you're more likely to get on for like 10 minutes or 15 minutes. You don't feel like you have to do this huge exercise or you have to sign up for something. If you
True.
have 15 minutes in your day, you could just jump on and do it. I don't think it's a bad idea.
Thank you. I'll be sure to tell my daughter.
Yeah. Is she going to get you a Peloton? I'm just kidding.
I'm sure
But
she'll argue the point, but
Was this helpful at all, or did you already know most of this information? Or just a good refresher?
I knew some of the information. I've been doing Zoom exercises twice a week.
Very good.
Yeah,
Very-
but then there were other things that I'm glad I tuned in for. Thank you.
Yeah. I think it's important just to remember to keep moving. You know, we have setbacks in life and we have COVID that's hit, but it's really important just to keep moving forward and to keep doing it. And you can always start small. You don't have to start off big, but you will feel better in the long run and your body will thank you for that as well. So yeah, thank you guys. Do you want to do it on mine, Jenny? Should I turn it? I don't know.
I was just gonna say, if you are feeling like you're in pain or, you know, maybe you're just sore the next day or something, make sure that you talk to somebody, a healthcare professional, your doctor, a personal trainer, a therapist, and just see if maybe there's a modification you can make, or if you have a certain condition, there's certain exercises that are better than others. So we try to give a good kind of overall general idea of different exercises, but no, they can still be tweaked and you can always progress them to make them harder or easier to modify them, whatever it might be. So hopefully it was helpful and thank you for tuning in, and we look forward to hopefully seeing you in person sometime to do a health talk, but thanks for coming and listening to us.
Thank you guys for being here. We'll work to get this information out to those seniors who aren't able to be here today, but we really appreciate it.
Perfect. Thank you so much.
See you guys.
Bye.
Bye.
Bye.